After I got out of college, I decided I would become a funeral director. I've enjoyed the funeral business. The lady I was talking to at the time, she said, are you all right? You're sweating. And I said, I'm fine.
Then he was on the floor.
And I must have been on the floor the next thing, and she called 911, and they took me out.
This branch here, which is the middle cerebral artery branch, is blocked by a blood clot. Mr. Packer, when he presented to the ER, he was very confused. He had a facial droop. He couldn't speak. He couldn't really understand commands. And he also had a complete paralysis of the left side. And after the procedure, he showed 100% recovery from his symptoms. This type of stroke is where there's an artery within the brain that is blocked, usually by a clot, and which stops flow to that part of the brain. And so that part of the brain begins to be injured and die. With stroke intervention, the objective is to open that artery back up before the brain that's supplied by that artery distribution is permanently injured. You guide the very small catheter over a wire using those x-rays to guide it all the way into the brain to the point where that clot is, where that blockage is, and you basically grab a hold of it and you pull the clot out, opening the artery back up and restoring flow to that part of the brain. With large strokes, it was very common that patients never got better. It became permanent very quickly. With stroke intervention, they take those patients that would not get better, and 25% of them do get better. That is actually a big number, considering that before there were 0. If you feel like someone you're with is having a stroke, it's very important to move quickly. The sooner you can get that patient to the appropriate center with the facilities to perform these procedures, the better. In our community, Sarasota Memorial Hospital is the only hospital that provides this service, the only hospital that has the capacity to provide this service, now or even in the near future.
Well, I think it's a miracle that he's still here. He was completely paralyzed on the left side of his body, and after the surgery the next day, they were amazed of how he came back.